What an incredible case you've been associated with. Tell me about the patient involved and how bad his condition was when he contracted COVID-19.
Look, the patient was very sick and was on a breathing machine, and the blood pressure was very low. We had to use a drug called noradrenaline to maintain it within a safe level, and his kidney function was deteriorating and he was not making much urine at all anymore, and there was a sense that his condition was going to progress. He was very, very sick, and there were a variety of interventions being applied, and we felt, given that we already had some preliminary information from some of the experimental studies that we had done, that it was appropriate to consider giving him megadose vitamin C. We had a discussion with all the treating teams, and we all agreed that this was the right thing to do, and we did give it to him, and we saw a response that was very similar to what we had seen in the experimental studies. The blood pressure picked up, the noradrenaline dose went down by about 80%, the temperature, which was very high, dropped by a couple of degrees, the urinary output went from about 10 to 15 to 300, 400 mils an hour. The kidney function improved. So we saw many of the things that we had seen in the experimental studies, and we saw a significant improvement. And so we were very pleased, and eventually the gentleman, over a period of time, continued to improve and was able to survive and be discharged home.
It's an extraordinary story, but your colleague had begun experimental research into large megadoses of vitamin C on animals, and he was starting to receive some results that looked promising. Is that how you knew about it?
That's absolutely right. So we've been working as a team for almost 20 years to do experimental work on the treatment of sepsis, severe infection, in a variety of different ways, and lately we've become interested in the concept that even though people had given high-dose vitamin C in the past, that it was not enough, and we needed to escalate it to megadose. And as I said to people, that's the equivalent of about 4,000 to 5,000 oranges being given intravenously to someone. And we started the experiments, and we were seeing things that we'd never seen before for very severe infections. And the people working at the Florey Institute Animal Research Lab were sending me texts and video clips of what was happening to the animals and how quickly they were improving with megadose vitamin C. It was almost unbelievable, but you know, it was happening repeatedly and repeatedly, so we had to accept that this was the reality of what was happening.
So administering 4,000 oranges is not something you can do at home, right? You can only do it in hospital.
Quite right you are. So, you know, this is a concentrated solution of vitamin C prepared for intravenous infusion. That's correct, yeah.
And so I presume this experimentation and research will continue, because if it's a possible answer to COVID-19, the whole world wants to know about it.
I think people will be very interested, and of course we are continuing this research. We are obtaining ethics approval to conduct more human studies, to expand the animal research and to create the basis for future treatments. And, you know, since the release of our experimental study, we have received multiple communications from all over the world. Clearly, there has been a response. This information is out there, and I'm sure there will be some clinicians that will try this intervention in their patients, and we will get more information as that happens around the world.
So what's your reaction to the news overnight that the UK's version of the TGA is actually able to roll out this Pfizer vaccine as early as next week?
Look, no one has seen the data except for the agencies, and so it's very difficult to make a judgment about why they've made a rapid decision like this and what information they have. So I'm really in an impossible position to comment, because none of us have seen the actual data. And so only the agencies such as the British TGA equivalent and pretty much at the same time, I'm sure the FDA in the United States are looking at the information. We're not privy to that, and it's very difficult to comment.
What we will be privy to, though, is how the rollout of this vaccine goes in the UK and whether there are side effects. It's an advantage to watch another continent experience a rollout of a vaccine because it gives us pretty good research data when we're about to roll out our own in March next year.
You're absolutely right. We've got this advantage that due to our response, we've been able to minimize and almost eliminate COVID-19 in Australia. So we have the luxury of being able to see what happens elsewhere when a vaccine is introduced, the logistic challenges, the side effects, the safety, the ability to roll it out. We are a very, very fortunate position. Absolutely correct.